So, Joe, you've had decades in ABA and you've had multiple leadership roles. What inspired you to launch Compass ABA?
Thanks for asking. Yeah, I had been working in the kind of ABA field and related fields for quite some time and really got to know the ins and outs of providing ABA therapy to children, to adults. Really gained a lot of experience along the way through my journey and thought during 2020, in the middle of a pandemic, seemed like a good time to start your own business. No, but seriously, asking around and talking to a lot of families in the New Jersey community, a lot of the services that they had been receiving um, had either gone away or never started, unfortunately, because of the pandemic. And as a sole practitioner, as a BCBA, I had kind of the business operations background too. I decided to kind of throw myself out there to see if I could help these families, most notably families that were Medicaid beneficiaries in New Jersey. As of 2020, it was just made available to them. And it was kind of terrible timing that a lot of the services had gone away at the time. So once again, I wanted to make what I believed as high quality services, high quality ABA therapy available to those families.
That's awesome. That's awesome. It makes complete sense. And I think COVID was a time of a lot of change for a lot of people, and some good, some not. Um, I think even after that, even after COVID, it's still been hard for a lot of families to get actual service for ABA services. So that it makes perfect sense. Um, so you mentioned that you've led both clinical and operations teams, but I also know that Compass has grown pretty rapidly in the last 5 years. How do you balance quality of care with scaling and growth? Because it's not sometimes those two seem to be opponents, not necessarily partners.
Yeah, no, exactly. You hit it on the head. It's I have to take off one hat and put on another one sometimes. It can be quite dichotomous. But in an effort towards that, I have brought on a clinical team separate from me. I'm not on it. And I've really given them the clinical keys to the company. I had to be someone that I really trusted. And it was our clinical director, Danielle Misera, trained under Vince Carbone, very strong with her verbal behavior skills and training, and just have the ultimate confidence in her, which helps. And I decided to do that just because I wanted to maintain the business side, even though I have no business training. I don't consider myself a business person, but I wanted to make sure that I was in a position to be able to make the business decisions to ensure clinical quality, if that makes sense.
Yeah, no, that makes complete sense. That makes complete sense. And it's not easy. It's not easy to let go of the reins of something that you know yourself very deeply. Um, and yeah, it's a scary time. And I think every leader has gone through it of being like, well, I don't have time to do good at these decisions, so I have to give up the power of the decision and give it to somebody else.
Yeah, I mean, it got to a point, a critical mass, where it was impossible to do both, and I made the choice to teach myself and learn the business operations and give up something that I knew very well. I knew that it would be taken care of, and left it to myself to take care of the business side.
Yeah, it makes complete sense, and it's probably one of the reasons you guys have been so successful too, is being able to actually give up that power and go to actual delegation. So tell me something about what you've learned with authorizations and payer relations over the last couple of years, because I know you've had deep experience in that, and I'd like to hear like what you think new service providers often get wrong.
Yes, if yeah, I just a word of advice. I know I'm maybe not supposed to give advice in this forum, but to people looking to either start their own practice or be a sole practitioner, like how I started, make sure that you know the ins and outs of your payers first. It's a big piece that I think a lot of clinicians are missing. They don't teach you about this stuff in grad school. This being said, that if your funding source is insurance reimbursement, like with Compass ABA, I know there's lots of other different funding sources out there, but if you're going into insurance-based ABA therapy, you have to know who you're partnering with essentially in the network that you're providing service to its members, and then make sure that your authorizations process and that your assessments templates, your data collection, and all related documents meet the medical necessity criteria for these payers.
Absolutely, absolutely, and it's not a simple process, and so it's better to learn it sooner rather than later.
Yeah, absolutely.
So many providers, especially in the ABA space right now, are really struggling with staffing, maintaining staff, keeping turnover low, that kind of stuff. What are some tips and tricks that you have, and how do you manage that kind of constant struggle?
Yeah, it is a constant struggle, and I would have hoped after almost 5 years of being operational that we would have figured it out by now. But to be brutally honest, we still haven't. It's still a struggle that we deal with every day. Hiring and retention is still our number one challenge facing an ABA company. And to be honest, the main reason is just too much demand, for better or worse. And to also ensure that we are putting people in positions that are going to be successful. Over the years, as we've scaled, we've definitely done a good job of making sure that we provide the tools, resources, and supervision to make sure that our employees are successful in their roles. But you have to make sure that you're hiring the right people too. And rather than just um, throwing unlimited human equity at problems, we do have a process where we ensure that we are hiring the right people to work with, you know, children with developmental disabilities. And I think that's important. I think even though, we may have to have difficult conversations with families about waiting a little while for the services, it is still important that we find the right match for them with a highly trained professional.
Absolutely. And not everyone can do the kind of work that you do, right? Not everyone can handle the pressure and can handle the difficult situations that sometimes arise in process of therapy.
Yeah, absolutely. There's some very niche experience that people have to work with. I mean, whether you're working with, different demographics, different people, it helps to have experience with that population. In this case, the autistic population.
Absolutely. Yeah, I mean, I, for instance, care deeply about this space. This is the only space we operate in, right? We only operate in the behavioral health space, and I couldn't do it at all. Like I know that I don't think I have the rocks to get it done.
Yeah, it's different. A lot
Yeah,
of patience, and it's exactly.
yeah. So if you could change something about the ABA business model in general for the industry, if you could change something overnight, what would it be and why?
My answer to that is quite simple, maybe not earth-shattering to some, or maybe just a controversial thing to say, but I think the prevailing business model, unfortunately, doesn't err on the side of providing high quality clinical services to people that need them. And I think, as the industry has grown into an industry, it's still weird for me to call it an industry, working with people with developmental disabilities for over 15 years, but it certainly is, and very integral to the whole, healthcare market in this country. But I think the focus, and I do see that with a lot of progressive movements, a lot of the do better collectives, moving towards re-emphasizing the high quality services being delivered to people with autism. And if anything, I have always wanted Compass ABA to be kind of the poster child for, if you do your job right, you can be successful. You don't have to cut corners. It doesn't have to be the bottom line. You get your ROI by just taking care of people and helping them live better lives.
Absolutely. But actually helping them progress and achieve their goals, not just servicing hours.
Exactly, exactly.
Yeah,
Helping them achieve their own targets and acquiring skills that they want to develop. Um, you know, at least from our perspective, the funding source will still be there if you do all those things. You don't need to cut corners. It'll grow. It'll grow on its own if you do it right.
absolutely. Well, especially considering the often overwhelming demand for services, you don't need to squeeze every person for every penny. You need to help them and then help them move on if you can. Because there's going to be more. There's going to be another kid that needs your services, or five, or six.
It's true. It's true. Especially, we're mostly in New York and New Jersey, very densely populated areas.
Yeah,
Unfortunately, there have been times where we have a waiting list, and yeah, we just always make sure that we're actually helping.
absolutely.